Oh, I'm getting feedback. Guys, is your laptop got the
Turn
sound
the
on?
volume down.
Okay. Good morning, everyone. This is Misha Martin. I'm the Director for Children and Family Services, and I have with me Tiffany Wright, Program Administrator for Foster Care and Adoption. We also have joining us today Dr. Tumilson from the Department of Health, and I can't see him now. So, Barry, how do we need to add so that we have Dr. Tumilson from Health? Because I know that he is on. Let's see. Give us just 1 second. He is joining us from the Department of Health, so he's not at our location. But while Barry is looking for him to join us to get us on video, because I think that we do have him via video. So give us just 1 second.
So sorry.
It's okay. There he is. There he is. Great. I mean, does he have a video too? Does he have a video?
No.
I can see you guys.
And we can hear you now. I think everyone can hear you. We're trying to figure out how to get your video on the screen. If you promote him to panelists, there we go. Can you share your video, Dr. Tomlinson? Will it allow you to do that? Is he on mute? Because we can't hear him. Unmute him?
Oh, yeah.
Okay. I think we accidentally muted you, Dr. Tomlinson. Can you hear us now? Wait.
Okay. Try it now. Can you hear me?
Yes, we can hear you. We can't see you.
All right, I'm going to hit start video.
Barry, can you hit his video there?
Adventures in teleconferencing.
Yes. That might be one thing that we get good at after all this is over is teleconferencing. We've been doing a lot lately. And I know that you have limited time, so we may have to just move forward without your video, and I apologize for that because we can't seem to figure out how to get you on video. Are you okay with just moving forward with audio?
That's fine. Yeah, that's fine with me.
And I just want to thank you so much for joining us on such short notice. But we did want to make sure that we had someone here from the Department of Health, and Dr. Tumilson spoke with our DHS, all DHS a couple of days ago and did an amazing job. So Dr. Tumilson, if it's okay, because I know we're limited on time, and we have our foster parents from across the state on. And
Hey, hello, everyone.
Yes. So I'll just turn it over to you if you don't mind.
Okay, what would you like me to talk about? Just a little information about the virus itself and the symptoms and...
Yes, okay. That would be great.
All right. So yes, the COVID-19 illness that's caused by this novel coronavirus, it causes symptoms that frankly, especially in children, are often like many other respiratory viruses that cause cough, can cause fever and shortness of breath. Those are the main ones we're seeing. In children, there's some information coming out that seem like it's also causing a little more often than in adults, causing some GI distress, like some diarrhea, not real severe diarrhea now, but some diarrhea, maybe a little vomiting. Those can happen in adults as well, but they've been seen to be more common in kids. However, even with that difference, still the most common symptoms for kids are fever, cough, and cold symptoms, including, if it's bad enough, shortness of breath. So those are the kind of symptoms we're talking about. Clearly that, is part of the difficulty with this virus, because it can look like the flu. It can look like a really bad cold. The good news, I think, is for children, since I know we're talking about foster children, the good news for children is that they don't have as severe of disease, meaning they don't get as badly sick as adults do. Specifically, the people that get the most sick with this disease are elderly people or people with significant medical problems like heart disease, like immunocompromised states from other things that are making their immune system not work properly, people with lung disease. Those are the people that are really having lots of problem. So that is kind of the symptom, but that's fortunate that children don't get as severely ill with it if they get infected, it seems like. That's not to say some kids can't get significantly ill with it, but that is a fortunate thing we've seen so far.
And so, Dr. Tomlinson, I know that you're willing to take some questions, even though we have limited time. So I want to ask a couple of questions of you too. So spring break is coming up. You know, our foster parents are absolutely amazing, and they're quarantined, some with lots of kids. What activities would you recommend that are appropriate during this time?
So, you know, what we really want to avoid is congregate setting. So some kind of social event or thing you're going to go where you're going to mix with lots, you know, not even lots, you know, a group of other people. I believe the governor's advice, as advised by the Secretary of Health, was to limit, you know, groups of people to 10 or less. So, you know, we don't want to go take a whole group of people, including children, to a large group meeting at this time. But that doesn't mean you can't go outside. You can go outside and play in your yard. You could go on a hike. You could go fishing with, you know, a few people, and that would be fine. We are trying to do this social distancing as much as possible from other people, you know, not in our household. We try to, you know, if someone's sick in our household, we need to do social distancing. But, you know, within a household, I think life can be fairly normal. But it's okay to go out. I think that's one thing. And even the governor mentioned that, you know, it's okay to go out and do something. Just don't go do something that puts you in contact with, you know, a group of other people.
And so also, so on that same note, you know, we have, again, wonderful foster parents who have been helping us through this time, and kids are still coming into foster care, as you probably know, because our staff is out there assessing and bringing kids into foster care. And we want to be good partners to our foster parents so that they can feel confident in the placements they take. Could you talk about some questions that maybe the foster parents should be asking us, and things that we've messaged our staff that they should be doing about assessing whether a child or a parent is sick, and what questions they really need to be asking before they feel comfortable taking a placement?
Well, I think, you know, one key thing that we're certainly working on is, has the person, whether the child or has the child been in close contact with someone with COVID-19? Because those are, you know, someone who's been in close contact. And what's close contact? You know, living in a home with someone with COVID-19, or being, you know, around someone with COVID-19 close, within 6 feet, you know, for more than 15, 30 minutes. Those are the people that are close contacts, you know, not just somebody who walked through a building where somebody with COVID-19 was. So, you know, that might be a good question. Has this child or been in contact with someone that was diagnosed by a lab test with COVID-19? So that, you know, and also, you know, do they have symptoms right now? Are they having fever? Are they having cough? Are they having shortness of breath? So those are questions to ask and see, you know, if they're currently ill, and then specifically if they've had that contact with someone that's already been diagnosed.
If our foster parents feel like somebody in their house has been exposed, what steps do they need to take?
Well, I mean, I guess it depends if they feel like someone in their house was exposed to a known case.
Yes, a known case.
Okay. Yeah, so, you know, I think you really just have to find out, you know, is that person really positive? You know, sometimes people, you know, diagnosing positive are conscientious, and they call their friends, the people they've had contact with, to let them know. Those people, you know, if you've had close contact with someone that is diagnosed case of COVID-19, you need to quarantine yourself for 14 days to make sure you don't then later develop symptoms of COVID-19 due to being close to that person with COVID-19. So, you know, that's the thing. The difficult thing is there's lots and lots of rumor going around right now. Oh, that person might have it, or, you know, things like that. So it really is someone that has been tested and known to have it, or is under investigation. And so we're asking those people if they have had close contact with them, to quarantine themselves for 14 days. Did that answer your question?
Yes, and so for the foster parents who are on, Dr. Tomlinson will take a couple of questions. You can see down on the bottom of your box, there's a question, answer, or a chat. We're monitoring both. So if you want, you have just a couple more minutes of asking Dr. Tomlinson some questions. I will be taking questions that are more specific to DCFS and not, more specific to the health department at the end after he exits. So we have time for a couple of questions. Lacey, are you seeing something that a question?
Yes. This was a lengthy one, so I'll read it.
Yes, speak up.
We have visits with 5 siblings from 5 different homes and across county lines. Bio mom and dad also have visits both at different times. TPR hearing is April 6th. If court date gets delayed, can we please stop visits? Our household is immune compromised and we are relying on multiple other families to not expose our foster child and bring it home with these visits. We already had to pull him from daycare due to our house being immune compromised. Our transport worker is worried.
Yeah, Lacey, I'm going to cut you off there. So that really is a case-specific question, and so we have messaged out to our staff to individually assess every case and determine what's in the best interest for the kids, but as well as your family. And so please get with your local staff and express your concerns about how that continued contact could allow exposure in your family, but there are other factors to consider. But we have messaged to staff, and you probably got in triage procedures about how we are encouraging FaceTime and other types of visitation. I'm going to talk about visitation a little bit later. So, but if there's questions for Dr. Tomlinson that are specifically related to the virus, or that you believe that the health department could answer, or he from the health department could answer for you, I want to take those questions. If it's specific to DCFS, we will get to them a little bit later. But Dr. Tomlinson, I'll give you a chance. Was there anything about the visitation question that you would like to jump in on? Because and as you may know, our foster families many of the children in their home are working a reunification with the bio families. And so visitation may be court-ordered or may be a part of the health of the child to continue to see their parent.
Yeah, I think, someone who, immune compromised people are at higher risk. Elderly people are at higher risk. And so those are things that I think certainly need to be taken into consideration regarding visitation. I don't know what your guidance was that you talked about sending out, but it certainly is something that needs to be factored in and considered about whether delays need to happen, or, would it be, having someone symptom screen the people that are going to visit to make sure they're not having any of those, asking questions about, have you had a cough? Have you had any shortness of breath? Have you had significant cold symptoms? Have you been around someone who has COVID-19 to try, and then maybe even checking their temperature if that's possible. Certainly at least ask them if they've had fever. And then, because right now we need sick people to stay at home, generally, not having anything to do with, just foster parents or visitation, but just generally we need people who are ill with symptoms to stay at home. And, hopefully parents that are wanting to, hopefully reunify with their children would understand. I'm sure they really want to see their children, but they also hopefully won't want to make their children sick either. And so that might be just something that it sounds like you've got a process in place. Hopefully it already includes that.
Okay. Hey, Lacey, I see a question from Ruth Hill. You want to ask that one?
Yes. My office is closed due to one person's waiting on test results. They should hear today if they are positive or not. So my house is under self-quarantine. How long will it take for the Arkansas Department of Health callers to advise? If she is positive, do we need to be tested?
If someone has been a contact to someone who ends up testing positive, we don't recommend testing if they have no symptoms. However, you're doing the right thing to self-quarantine right now, and that's very wise. I'm glad you're doing that. The reason we don't just, at this point, don't just test everybody that's been a contact, one is because we would very quickly run out of tests, but even more importantly, we don't know if the test is valid when people have no symptoms. So because sometimes you have no symptoms yet, even if you've got the virus, but it's just not reproducing enough in your body yet to show up on a test. We could swab your nose, it says negative, and then later on, 3 or 4 days down the line, you get symptoms that could have been from COVID-19. So we just haven't proven yet that the test is accurate before people have symptoms. So that is a big part of why we don't just test everyone who's been a contact. Now, certainly the quarantine is necessary. That's what we do because there's this vagueness, there's this uncertainty with the whole incubation period. And so that is very important. I'm very glad you're doing that.
Thank you. Thank you. So I'm looking over the questions. I'm seeing lots of questions that, that I think that I will answer later on in this webinar, but I'm not seeing any specific. Oh, Megan's saying there's one. Go ahead.
How can we strengthen the immune system in our children?
Well, I think, there's no magic pill that strengthens our immune system. I think healthy living is what strengthens our immune system. So a good diet, which hopefully your children are already doing, make sure they're drinking plenty of water, cutting down on carbonated beverages or cutting them out. These are things, right, that are general advice doctors give for kids to be healthy. And those are important. Also getting plenty of rest. Children need to be on their more or less normal sleep routine. Now things get all cattywampus when kids aren't in school and we're out of our routine. And so I certainly understand that as a parent, but it's something we need to continue to work on because getting enough rest is very important for our immune systems. Healthy diet, those kind of things are very important for our immune systems now. I have a friend who's a doctor that, people often wonder about, taking multivitamins, is that going to boost your immune system, et cetera. I have a friend who would always say we should eat our vitamins, meaning if we're eating good, healthy food, a variety of fruits, vegetables, healthy meats, those things will give us the vitamins we need.
I've got another one. Can you provide clarification on what symptoms are? We have children that often have colds, sinus issues, and small coughs. What do we need to consider symptoms specific to COVID-19 or simply just a cough and cold?
Yeah, it's difficult. It's not an easy question. It's kind of the combination of things. If they've got fever and a cough and significant cold symptoms, then it would make you wonder. The other part of that is there any exposure that makes us think they're at risk for it? So like we talked about travel, but more specifically now, contact with someone who is either being investigated for COVID-19 or already has a positive test. And I think, a lot of those are questions that you may just have to get in touch with your medical provider, your doctor, your nurse practitioner, whoever it is that normally provides care to that child. There are some screening facilities. There are even starting to be a number of kind of telehealth options where people can video chat with a provider. These aren't things the Department of Health does. These are things different medical systems like UMS and Baptist and others are doing that can be found. Maybe even, I don't know, y'all at DHS, if you can kind of find some of those options. Those might be good things that parents can kind of do from home to kind of, figure out if they need to go another step or not. And so those things could be helpful in getting in touch with some kind of medical provider.
Okay, thank you. And guys, any more questions for Dr. Tomlinson? Because I want to be respectful of his time. You guys are receiving anything additional? I mean, we are seeing additional questions that we will get to. Dr. Tomlinson, I want to say thank you so much for taking time. I know that you guys are really busy over at the health department, so I really appreciate you taking time to talk with our foster parents and join us today. So thank you.
You're welcome. I just want to say one other thing. The reason it's important to contact your doctor is because your doctor is going to know more. I mean, I think the telehealth options are fine. Those would be a good starting point. Your doctor, though, may have something set up at their clinic where they're able to screen, or they're more likely to know what's available locally. Because I know y'all are spread throughout the state. Something that's in Central Arkansas wouldn't necessarily be helpful to you. So your doctor will hopefully have a better recommendation if they think someone needs to be checked out medically. What we don't want is people just showing up at emergency rooms when they're not emergently sick or significantly ill. We want to reserve that for the people who are really ill. And remember, people, kids are falling and breaking bones and people are having heart attacks. They still need to go to the emergency room. So we're trying to keep, that's why a lot of places are setting up, set aside kind of screening facilities or checkpoints to kind of be able to attend to people that need to be evaluated by a physician or a clinical provider, but not just have everybody run to the ER.
Okay, thank you. Thank you so much. Thanks again.
You're very welcome. Y'all have a good day.
Thank you. Bye-bye. Okay, to everybody else, I just want to pick back up and say thank you to everybody who has joined us. Again, I see that there are a lot of questions and we want to get to them. There's just a few items that I want to cover. This is difficult times for you guys, and I just want to recognize that, but appreciate how much we know that you guys are doing out there for the children in the state. There's almost now, we are already seeing an increase of kids in foster care. So there's almost 4,400 children in foster care today. And each of you is making a huge difference in making sure that they have a safe, appropriate family to be with. And it's even harder when you're quarantined and school is out. And I mean, I suspect that there are several of you who want to pull your hair out, but thank you for sticking with this. I just have 2 kids at home and my family is taking turns and helping them. So, and I know by the time I get home at the end of the day, they are ready for me to come in and help out with the kids. So my husband specifically, but I got a whole support team. So hopefully you guys are able to still use your support team, but keep everybody safe and healthy. And I just want to say thank you. The other thing that I want to thank everyone for is the continued willingness to take placements. It has been a very big struggle for our staff across the state, but many of you have stepped up and been willing to take placements because, as you know, kids are still coming into foster care. Abuse and neglect is still happening, and our staff are still going out and assessing emergency situations and having to bring kids into care. So I want to thank each one of you who has stepped up and said, I'm willing to take this child into my home. So, and I even have a friend who took in twins. I won't call him out, but you know who you are. And so thanks for taking the call from Tiffany and doing that. And there's several other of you that have really stepped up. We are also hearing from you questions and concerns about visitation. This situation is changing every day and sometimes by the hour. And so initially, as the situation started, we were really encouraging to continue visits as usual. We had court orders in place. We needed to work with our legal team to gain some flexibility around those court orders. As of, I believe, Wednesday, we sent out directions to really start limiting the face-to-face contact, but still with the value that we know that kids need to see their families for their emotional and mental health, whether that be in person or whether that be FaceTime. But what we did not do was we did not send out a black and white rule about this has to happen in every single case, because as you know, every case is different and every child's needs are different. And so what we have encouraged our staff to do is assess those cases on a case-by-case basis, factor in what's going on in the community with the COVID virus, and also factor in the health of the child and what the child needs are, and make a decision based on the placement. Our staff also have to factor in what the court order says. We have worked with our legal team to try and get some flexibility around visitations, and some of that is still in the works. So we are really pushing for FaceTime because all of our staff have iPhones, but sometimes we need your help with coordinating that visit using your phone so that my staff person doesn't show up at your house with a phone and then coordinate the visits. So every case is going to be different. I need you to be communicating with your caseworker if you have specific issues in your home, like if you have a child that's medically fragile or you have a child that really has some situation that compromises them, or you have an adult in your household. Maybe you're a relative foster home and you have somebody in your home who is fighting a disease and under treatment like cancer or whatnot. So making sure that you're communicating those concerns as well as a visitation plan is being created. But this has been changing and flowing every day. So what you talked about the worker on Monday and the worker giving guidance that they were continuing in-person visits, it might be different now that they have worked with their OCC and worked with the ad litem and others and assessed the situation to determine whether that FaceTime visit is appropriate. We are really encouraging that the child still see their parent who is really working the case and involved and active towards reunification, that they're still seeing and having those connections. We do not want this crisis to keep children in foster care longer than they have to be there. So we want to acknowledge that we're having a public health emergency, but we don't want to forget that we are still the parent of 4,400 children who have needs and need to be back with the family and not raised by the state. And so trying to move the system forward, but also identify those essential functions. I'm not going to go over the entire triage recommendation that we sent out to staff because we did send that to you guys as well. So I encourage you to really look at that. And what you see is it is not rules, but it is guidance. And so anytime that staff are assessing and determine that face-to-face contact, whether with the parent, whether with you guys, because there may be some situations that there is a necessity to do some face-to-face contact with you guys, that they are asking the 4 questions. Do you have a fever? Have you traveled outside of the state or out of the country in the last 14 days? Have you come in close contact with somebody who has a laboratory confirmed COVID diagnosis? Is your home under a quarantine by the Arkansas Department of Health? So if you're answering yes to those, then we're not going to be coming in. But hopefully this is not a situation with a foster home, but a situation with a bio parent. Our staff may have to get in order to investigate and take a healthcare professional, because if we believe that a child is in immediate danger, we have a responsibility to assess that situation and take action. So again, hopefully that does not apply specifically to foster homes, but I just want you to be aware that our staff are not going home and not going to have face-to-face contact, because our role as child welfare is still for the protection and the care of the children that we're charged with. I'm going to move on again to placements. I know we've talked about that a little bit, but still encouraging and begging, honestly, to consider placements and work with that worker. The worker should be taking children for initial health assessments still, and so those conversations can happen. They should know whether a child has had fever. They should be having conversations with the bio parents about the COVID-19 and what their exposure has been. And so that if it makes you feel more comfortable, and I hope you do, ask those questions of our workers, and then if they cannot give you answers, then hopefully they can get back with you very quickly and get some answers about those particular situations so that you can feel comfortable in taking placements in your home. So Tiffany, is there anything you want to add to what I've already said?
I don't think so.
Okay, so I see that we have a long list of questions, and Lacey and Megan, I'm having trouble because if y'all see me doing lots of looking up, I can see the video on the TV at the end of the conference room, and so I'm trying to read the questions myself, but my vision is not that great. So Megan and Lacey are going to have to help me some and triage questions, but we'll just open it up to questions, and then Tiffany can tag team and help on that. So go ahead, Lacey.
We have a lot of daycare questions. So one is, can you speak on rules for daycare? We are social distancing, but are told we still have to send our 2.5-year-old to daycare because he receives therapies there and is on a voucher. This then contradicts all our efforts to social distance.
So, okay, I'm gonna struggle with some of these case-specific questions, and I'm gonna tell you again that you're probably need to follow up with the supervisor, and you may even need to rope in Lacey or Tiffany, because there's a lot of things about that question that honestly I'm confused about. One being, who told you have to send your kid to daycare? So, I mean, there is an individual assessment on that case, and maybe the local team felt like the therapies were necessary. So I don't want to give you an answer specifically related to therapy, but what I will say is, if you are receiving a voucher, that is not a reason that you have to go to daycare. So, and Tiffany, do you want to add in on that?
No, and Michelle, we actually have, Lacey and I are going to do some follow-up with DCCEC because there were some concerns about will they lose their voucher if they're not attending and the child care center is open. And so we plan to communicate with our sister agency to find out exactly what is their recommendation surrounding that. We don't want you to lose your voucher, but we need to double check with what their messaging
And,
is.
and I can tell you, like, and I agree with Tiffany, we're gonna have to get with them and follow up. But that is our sister agency, and you guys are our foster parents. You are not going to lose your voucher. We will figure out how to make it work. If you guys should not be sending your kids to daycare just because of the voucher reason. Now, I cannot speak to the therapy reason because I think that gets into more of a case-by-case analysis, and I'm not sure about what all is going on there. So I'm just going to move on, but we definitely need to follow up on that particular case with the supervisor and even involve the area director if necessary, or Tiffany and Lacey related to the therapy. Lacey, you want to go on the next one?
We do have a question about WIC. It's why is WIC still requiring foster parents and child to continue to come to their office every month?
So I am not a WIC expert, but I can also tell you that things are changing day by day by day, and I'm certainly not going to answer that question right now, but we will look into it. And the governor had a press conference yesterday related to state employees, and it's ever evolving, and I suspect that today's press conference at 1:30 may have some additional information related to government offices. So we can take that as a follow-up. I suspect that there will be some more information coming out about government offices based on the governor's announcement yesterday.
Are we allowed to leave the state if foster family has a relative that needs to be visited? Can we take our foster children with us?
What you need to do is you need to submit it to the, and Tiffany, help me remember where we're submitting, but that travel is coming up through the area directors to me. And so you need to make a request and submit that travel. We sent out an email to all the foster parents about out-of-state travel. And so each one is being assessed on a case-by-case basis, and we're working with the health department. But I can tell you a week ago, there was a lot more travel allowed than what is today. So we are strongly discouraging out-of-state travel as given guidance by the governor strongly. We've even asked some foster parents to cancel vacations that they were taking next week, working closely with the health department. So I cannot answer that question specifically, but you need to send it up, and I can tell you we're looking at hotspots, but it seems like every day we're reducing the number of out-of-state travel that we are allowing to occur.
Are children coming into care being screened differently?
So differently than maybe the general public, because we are going to the initial health assessment. The staff should be asking the 4 questions that I've already gone over. And so there should be a more thorough assessment related specifically to the COVID virus.
Will foster homes that are due for recertification be granted an extension if the expiration date falls under this time?
We are trying to work out the specifics of that right now. That is a possibility. We haven't given out specific guidance on what will happen with the reevaluations, but what we have said on our triage recommendations, that reevaluations and going into the home, that if that is not absolutely necessary, then that needs to go on the back burner. So that is something we're thinking about and working through. We need foster homes, so we don't want you to become unavailable just because your reevaluation happens during this time and the paperwork is not completed. Because I'll be honest, on our triage to staff, that is lower on our list of getting our essential duties done. So more information to come on that.
This next question is related to court hearings. Do you think if we won't have a court hearing in person, if maybe they will be able to do some type of virtual hearings, maybe through Zoom or Skype?
We don't have any messages on that right now. I can tell you that some of the judges are exploring how to do adoption hearings so that kids can get to permanency, since that's key. The Supreme Court put out a procurum that's effective. I can't remember to the date, but we can share that with you guys about the Supreme Court's procurum on court hearings. I suspect like us, they will ever evolve as this situation continues, but Tiffany, we can make sure to share the Supreme Court's guidance related to court hearings with the foster parents after this. Okay. Okay, this is your opportunity. I'm willing to take any question. Honestly, if I have to follow up, we can then follow up and do a question answer that we then send out to you guys via email, so that you have the opportunity to, even if I don't know the answer today, we can then get it back to you and put all the answers to these questions in an email to everyone. Lacey?
We have a question. It says, my husband's CPR expires in April. Obviously, no classes are happening right now. Are we okay to delay?
Can you even take that one?
So I think right now that will become part of what's happening with the reevaluation status. I do know that you can do your online testing part and then do skills demonstration down the road. If you cannot get into an immediate class right now, we have guidance on that we can also send out to all of you, so you have that available.
This one is about, it says, what about cases that are being appealed cases? Will those appeals continue to move forward?
That is a question for the courts, but we will get an answer. I am not sure what the Court of Appeals is doing. It may be in the per curiam, and I was looking specifically to the juvenile court. So we can look at the guidance and reach out to the administrative office of the court and see about that. I'm sorry, I don't have an answer on that question.
This one's kind of related. It says court hearings as well. If a new hold is taken, will there be a PC hearing? Will the requirement for medical appointments, et cetera, be waived during this time if we cannot get appointments?
Okay, that was several questions in one. So right now, the courts are still having probable cause hearings. And so as of the last information that I got, that was an specific exception on not having court hearings, but probable cause hearings would happen. I believe the second question was related to medical appointments. And so non-necessary medical appointments, it's a case-by-case assessment on whether you can skip those, but necessary medical appointments, many of the medical providers are screening before, but continuing to have those appointments. So definitely need to keep your caseworker and the supervisor in the loop about what medical appointments are coming up. And if you're counseling, having a discussion about is it necessary to cancel that, or do they need to help you with transportation or otherwise?
And then right now at this time, for new entries into foster care, we have to have PACE evaluations. And at this time, PACE evaluations have been canceled. And so I know our the PACE evaluation UAMS, they are working to figure out other options that they could deploy during this time. And so we're just waiting to get further guidance from them on what they have available to do to support as well.
Is the need for foster homes more critical right now than normal?
I think we always have a critical need for foster homes. So in our daily COVID meeting discussion around placements, my question is this normal DCFS placement issue, or is this something new? I will say really more this past weekend, but not in the last couple of days, we did see some areas that have had younger siblings come into care, have trouble with placements, and that is not normal DCFS. So normal DCFS placement issues really are normally our older kids and larger sibling groups. But since, and Megan and or Tiffany,
mm-hmm.
Yeah, you want to comment on that?
Yeah, so this week we have felt an increase in placement needs, especially for those younger sibling groups. So 6, 7, 8-year-olds that we are struggling to find placement for. It's really hard to gauge, is it normal because it's a sibling group, or is it because of the current COVID virus crisis? So I would say it's a mix of both, but we always have placement needs. We always have the need for foster homes because that's where we want our children to be placed with families.
We're getting a lot of daycare questions. So I think this is something, like we've mentioned earlier, Tiffany and I will follow up with our partners with DCCEC with more guidance on how to answer these specific questions.
Okay.
We have one, since schools are closed, what guidelines can you give for care during the day while parents work? A sitter in our home is okay, even though we were looking at several weeks of care.
Yeah, so we are all about this reasonable, prudent parent standard. So we want you to be the reasonable, prudent parent that you are with your own children, with our children. So there was some policy around 10 hours of babysitting in the day. So 8. It was 8. We are being more flexible, not a black and white rule. Like if you have to work and one day it has to be longer, nobody's going to come knock on your door. But we need you to be a reasonable and prudent parent about the childcare that you're choosing. If you are needing assistance, you can reach out to us. We have limited capability as well, but if you want to explore, if you're thinking about getting creative on childcare and you don't really think it meets the rule, please reach out and talk to us about that. Because if there truly isn't a safety issue and you are being a reasonable, prudent parent, then we want to support you in finding childcare.
How are monthly visits with caseworkers being handled? Are they still continuing?
They are, but we've asked them to do them via FaceTime. So if they don't have a concern about the safety in your home, like say they've been in your home pretty regularly and don't have any concerns, then they can do those via FaceTime. Like I mentioned earlier, caseworkers do have iPhones. They also have an approved app called Zoom. And so if for some reason you don't have an iPhone and FaceTime doesn't work, I'm not a technology person, but they do have the ability to do Zoom. We might have to ask you to download Zoom, but it's not just a voice call. If they're gonna check it as a face-to-face visit in your home, they're gonna have to have some type of video conferencing, and that guidance came down from us, and then a day later it came down from the federal government as well. Lacey, you have additional?
Yeah, let's see. Have y'all considered sending out a document where people can update if they're taking placements and what age range they can accept?
So I had an idea to do a survey monkey and have you respond to us. And so we'll probably be having further conversations about what that looks like. However, if you know right now what you would like to do as far as placements, and you're willing to help out during this time, you can email your local staff. You can let Lacey and I know. We would be very grateful for that information.
Are there online therapy options, physical, occupational, mental health, etc.? I believe previously Medicaid wouldn't cover them. Any changes?
Not that I'm aware of. There has been some movement around telehealth, and I am not completely up to that. I know that Ann Wells, our assistant director here, is putting together a briefing to me related to telehealth and therapy. And so as soon as I get that we were going to share with staff, I'll share with y'all. I'm not sure that it will specifically address like occupational. It was more mental health therapy. But we can check with our Medicaid folks and get back to you on any exceptions related to telehealth.
I've tried taking more younger kids, but I need a waiver for under 6. Why can we not get a waiver anymore?
Well, waivers are still allowed, but every case is a case-by-case basis. And so we really are going to look at, is this a sibling group that you're putting into your home so that, we're making an accommodation for a sibling group? If it's a mixed match of kids under 6, what are the capabilities of caring for all those kids and making sure that their needs are taken care of? So it's not a blanket approval. You'll hear this from me a lot. Every case is different. Every child is different. We have to assess and determine whether that would be appropriate for those kids. And what do you want to add?
I also want to just say, we love and appreciate that you want to help and that you want to take extra additional children, but we also will need you when this is over. And so we don't want to burn you out, and we don't want to blanket fill kids in homes and have everyone running on a higher level of stress and chaos. And so it is a balance. And so that's why they're all carefully being looked at on a case-by-case situation based on the kids that are in the home and the kids that we want to add to the home.
Can we get guidance for TFC agencies and providing home visits? Contract requires TFC agencies continuing to provide in-home weekly sessions at this point. So this might be
That's a Megan question. That's a Megan. We're gonna have to get back. We're gonna have to get back to you, aren't we?
Yeah, that I would say that's probably a partial licensing question. And I can reach out to PRLU and get a response to all the providers.
Will there be a single source of information? Currently, I receive emails from multiple sources.
Are you talking about emails from me versus Lacey? Because we're the only, I mean, unless our local staff are also pushing emails, however, it'll either come from Lacey and I. And typically if it's from Misha, we leave Misha's signature at the bottom, but it's either from Lacey or I.
If we feel okay with helping with parents' visits via FaceTime, is that okay for us to do if the department is okay for us to do them one time weekly?
I'm so glad you asked that question. So as long as the team knows that that's what's going on, we would love if our foster parents would help coordinate those visits via Zoom, because, you know, if not, I mentioned this earlier, the worker is going to have to come to your house and then use their phone or technology to then coordinate that visit. So if we could get some support from the foster parents to say, you know what, you can use my phone, or we'll go in this room and facilitate, I think that would be a huge support to our staff, as well as the whole situation and coordination. But again, every situation is a little bit different, so you're gonna have to coordinate with your caseworker and just make sure that they know what the plan is, or you've talked to them and they've created a plan. But, you know, just making sure that everybody's on the same page about what is the plan for visitation.
Can online continuing education hour allowances be raised for open homes?
Oh, I think that's something that we'll be discussing in the future, as far as what can we do for continuing education to ensure that you're still getting high quality continuing education, and how can we make it so it best supports you.
Okay, and I apologize. If you see me over here texting, it's because we've got lots of irons in the fires over here, and I'm sorry to be disrespectful to you guys, but I'm also trying to manage about 15 other things that are going on. So, but you guys are important to me. You're important to us. We wanted to give you an opportunity to ask questions. If you have more questions after this, you can always send them. If they are case specific, please make sure that you're looping in your supervisor as well. And remember, the portal has both cell numbers and contact information for both the worker and the supervisor. I hear it pretty regularly that people don't want to go directly to the supervisor and include them because it's you know, maybe they feel like they're getting the worker in trouble. But we are in a time where it's going to take all hands on deck to answer questions and work, and we're really going down to essential. In addition, at DCFS, we have staff out because they don't have childcare issues, and so if they if they cannot work remotely and take care of their kids, you know, we have staff that are out because of childcare issues. We have staff out because they were determined to be at risk, meaning older than 65 or having the chronic health conditions at the health department. So we've lost almost 10% of our workforce now because of that categorization. We're trying to figure out how to get them to work remotely, as well as trying to get our staff ready to do more remote work. So there's a lot happening and a lot changing. So whatever I need you to include supervisors if you're having questions and concerns, because, you know, it's already difficult on a day-to-day basis for the local team to have good communication. So it's probably going to be harder right now, but you're still a priority to us. So make sure, just go ahead and include the supervisor on any communication so that we can try and get a response to you as quickly as needed. If you have more of a systems questions for us, you can always reach out to Tiffany, Lacey, Megan Bush, or myself, or you can CC all of us and one of us will get to it at some point. So we want you to know that you are still a value to us, and what you are doing is critical to making sure that these kids are safe. So thank you so much for everything that you're doing, and I'm sure that we will be in touch. And as I have more information, please look for your email, and probably sometime next week, if we have new information, we'll set up another Zoom. So thank you again. Stay calm. It's good. We're going to get through this. We always do. And I'll see you next time.